Hey Sportsman class.
Hey.
I am Dr. Han, Dr. Goodwin here, and we are here to show you how to apply splint and the information behind it.
So, first we're going to go over what is a splint. So basically a splint is a piece of medical equipment, although sometimes it's not. If you're DIYing it, maybe newspaper, a stick, but
Even cardboard.
yeah. It's a piece of medical equipment, quote unquote, that is used to protect from further injury to a specific part of the body. So, if you injure your forearm, you would put a splint on it to make sure it doesn't get further injured.
Yep. And then also to keep it from any movement, like you don't want to move at all. Just keep it stable.
Make sure it's stabilized. It's also used to prevent severe strain or sprain.
It's to decrease pain and swelling.
And it's also used to keep bones straight while healing. So we are gonna go through some of the splints, common splints that you may come into contact with.
So this is an ankle stirrup. It keeps your foot at a 90-degree angle.
This is a forearm splint, so it'd go right here, like that.
This is a posterior elbow splint. Keeps your elbow at a 90-degree also.
This is a hand splint. So there's some straps right here to keep your fingers in place.
This is a posterior leg splint. It covers the whole leg.
So there's more splints, like there's a sugar tongue splint, there's finger splints, a nasal splint, but those are just some of the few. This is your hand splint. Not perfect, but we just want to stabilize the hand for now before we, get her to the hospital. She hurt her elbow in the fall from the swing, so I'm going to go ahead and pull out my handy dandy elbow splint. And again, you can use anything. I have newspaper in here, just in case you never know. But this one I do have an elbow splint for. So we're going to go ahead and, make sure the elbow is stabilized. It's tight, it's not going to bend. So I'm going to go ahead and have Dr. Han help me tape this.
This right here is an elbow splint. We got to clean up her nose.
As you can see, her nose is a little crooked here, so we're going to be applying a nose splint today.
Yep.
These ones can be pretty painful, so
Hold on.
So here Dr. Han is going to apply the nose splint. Looks
This
something
nose
like
splint will
this.
go directly in your nose hole. This splint will go directly in your nose hole. Others call it nostril.
Nose hole, nostril, fish wash.
Alright, ready? I'm gonna apply with pressure. It's gonna be okay.
Ah! Okay, so it's about 8:30 p.m. and this patient just hurt her arm on the trampoline. She was trying to do some tricks. Very common, so you need to be aware of how to apply this forearm splint. So you're going to have a splint that looks about like this. As I said, it could be newspaper, stick, whatever. So you're just going to place it right here from the wrist going to the elbow and tape that up. And then you will be good to go. Not too tight, not too...
Foot splint, it keeps it at a 90-degree angle. Here we attach it at the leg. Another one. And then the foot.
Okay, so I just arrived at the scene. Don't have any tape on this one either. So our patient just fell out of her cycling can, and she appears to have hurt her whole leg. So we're going to go ahead and splint her up. We have a huge splint here. So, you know, if this happens to somebody you know, when you're around someone, you know, they fall out of a trash can, make sure to have a large splint for the whole leg. So, you know, just go from like hip all the way to ankle. You need to apply tape just like that. Make sure, you know, the leg is stable. It's not going to get injured anymore. So there's your leg
So thank
splint.
you, sports med class. I
Yes.
hope you learned and gathered information on how to do this.
How to apply splint, many situations.
You never know when you're going to be put in that position to do that.
May even have to use newspaper, but that's okay.
Maybe you'll have to use a stick.
Yep.
All right, Dr. Hahn, I'm out.
Good one, signing off.